Ever wonder what happened when you got sick in the Middle Ages and the person treating you had a razor, a prayer, and the confidence of a man who absolutely should not have had that much confidence? Welcome to medieval medicine, where the cure could be deadlier than the ailment. If you were unlucky enough to fall ill, your best hope was not a miracle. It was a barber surgeon, which is a fancy way of saying the guy who cut hair on Tuesday might be cutting into your flesh by Friday. Same hands, same chair, wildly different stakes. You wake up in a stone room, sweating through a fever, and somebody tells you not to worry because they've got this. This might mean bleeding you, burning you, purging you, or handing you a prayer and a grim look. Medieval medicine was not built on modern science. It was built on guesswork, ancient theory, religious belief, and the kind of optimism that would get a person roasted alive in a modern hospital review. Doctors believed the body was governed by 4 humors: blood, phlegm, yellow bile, and black bile, and illness meant those fluids were out of balance. So instead of asking what actually caused the problem, they asked which fluid was acting like a Karen at closing time. That meant treatment often started with bloodletting. If you had a fever, bleed you. If you had a headache, bleed you. If you had a cough, bleed you. If you had a broken leg, well, maybe bleed you, and then pray the leg forgave everybody involved. The logic was simple in the same way a brick to the face is simple. Too much blood was thought to cause trouble, so removing some of it might restore balance. In reality, it often left patients weaker, dizzy, and more likely to collapse than recover. But hey, at least the theory sounded neat on parchment. And barber surgeons were not just there for bloodletting. They handled tooth pulling, wound cleaning, minor surgery, and all the messy jobs that educated physicians often considered beneath them. Physicians liked theory. Barber surgeons liked blades. When a battlefield wound opened up like a bad decision, the barber surgeon might cauterize it with hot iron, pack it with herbs, or stitch it shut with whatever thread was available. Sometimes that helped. Sometimes it just added fire to the problem. Medieval medicine loved a dramatic entrance. Important warning, medieval style. Infection was everywhere, and nobody knew about germs. A wound could look fine one day and turn into a rotting disaster the next. Dirty hands, dirty tools, dirty bandages, dirty water, dirty everything. The body was fighting for its life while the treatment team was basically gaslighting it with a knife. If a patient survived, people called it a success. If they died, well, the disease was blamed, the stars were blamed, God was blamed, or the patient was blamed for having the audacity to be mortal. And then there were the remedies that sound like they were invented by someone trying to win a dare. Herbal mixtures, animal parts, mineral powders, charms, incense, and prayers all lived side by side in the medieval medical toolbox. Some remedies had real effects. Others were pure ritual dressed up as expertise. Honey could help wounds. Certain herbs could ease pain or calm the stomach. But medieval practitioners did not have the luxury of knowing which treatments worked, which ones were useless, and which ones were quietly poisoning the patient while everyone nodded like this was fine. That uncertainty was the whole game. Guess, observe, repeat, and hope the patient did not expire before the next round. The rich were not exactly safe either. They might get better food, cleaner rooms, and more attention, but they were still trapped inside the same medical worldview. A nobleman with a fever could be bled by a court physician just as easily as a peasant could be bled by a barber surgeon. The difference was mostly in the furniture. One got treated in a palace. The other got treated in a hut. Same blade, different wallpaper. And if the illness was severe, the options got even uglier. Surgery without anesthesia was a nightmare. Alcohol, herbs, and opiates could dull pain a little, but not enough to make the experience pleasant. Imagine being awake while someone cuts, burns, or drills into your body with no real understanding of anatomy and no reliable way to stop bleeding or infection. That was not healthcare. That was a live-action horror show with a religious soundtrack. Medieval medicine was not stupid because medieval people were stupid. It was terrifying because they were doing their best with the tools and ideas they had. They observed, they experimented, they copied ancient authorities, and they prayed hard enough to shake the rafters. But without germ theory, modern surgery, antibiotics, or real clinical testing, even the most confident healer could become a walking hazard. The barber surgeon might arrive looking like salvation and leave looking like the opening act for your funeral. So if you were sick in the Middle Ages, you were not just fighting the disease. You were fighting the treatment, the theory behind the treatment, and the man holding the blade. And that is exactly why medieval medicine was such a brutal gamble, because in that world, the cure could be deadlier than the ailment. That is where trepanning enters the chat like the worst house call in history. Trepanning, or trepanation, meant cutting or drilling a hole into the skull. Yes, really, a literal opening in the head. The idea was that pressure, bad humors, trapped blood, or even evil influences could be released through the hole. In some cases, people may have survived the procedure, which is honestly the kind of sentence that sounds like a joke until you remember this was real life. Medieval practitioners did not invent trepanning because they were bored and wanted to cosplay as carpenters. They believed the skull could trap dangerous pressure or corruption inside the head. A person with seizures, severe headaches, confusion, or strange behavior might be seen as someone whose inner balance had gone feral. And yes, the tools were exactly as horrifying as you are imagining. A trepan, a drill, a saw, a scraper. But in a world where pain, madness, and unexplained illness were all tangled together, trepanning looked like a serious answer to a terrifying problem. It was brutal, but it was also rational within their worldview. That is the part that makes it so grim. It was not random cruelty. It was organized desperation. Then there was bloodletting, the medieval classic, the all-time champion of making a sick person weaker in the name of balance. If the humors were out of line, then blood was often the first thing to go. Too much blood, too hot blood, bad blood, corrupted blood, blood that needed to be humbled. So the healer reached for a lancet, a phlegm, or a leech and got to work. The patient might be bled from the arm, the foot, or another carefully chosen spot depending on the illness, the season, the moon, and the healer's favorite ancient authority. Because apparently your veins were not just veins. They were a map of the universe, and somebody with a blade was about to edit it. Bloodletting was based on the humoral theory that health depended on balance. If you had a fever, inflammation, a headache, or a swelling, the answer might be to remove blood and reduce the supposed excess heat. If you were too full of blood, too angry, too flushed, too congested, too whatever, then out it came. Medieval medicine loved a good subtraction. The body was treated like a barrel that had overfilled, and the solution was to open a tap and let some of the contents spill onto the floor. Elegant? No. Consistent? Absolutely. Safe? Not even close. And because medieval medicine loved a ritual almost as much as a remedy, bloodletting was often scheduled with impressive confidence. There were charts, rules, and timing systems. Certain days were better than others. Certain signs of the zodiac mattered. Certain seasons mattered. Certain illnesses were thought to respond better than others. This was not random, but it was still wildly speculative, like trying to fix a sinking ship by consulting astrology and then punching a hole in the hull for balance. Sometimes bloodletting may have helped in a limited way, especially if a patient had dangerously high blood pressure or a condition that benefited from reducing volume. But medieval practitioners did not know that. They were not measuring blood pressure. They were not checking lab values. They were following a theory that made sense to them and hoping the patient did not faint, collapse, or quietly die from the very treatment meant to restore order. Leeches deserve their own special mention because they are the little goblins of medieval medicine. Slimy, blood-sucking, and somehow promoted to healthcare worker. Leeches were used because they could draw blood in a controlled way, at least compared with a blade and a shaky hand. In theory, they were gentler. In practice, they were still part of the same logic. Remove the excess. Restore the balance. Pretend the body is a ledger and blood is just a number you can subtract until the universe calms down. The irony, of course, is that the patient often became weaker, paler, and more vulnerable. But hey, at least the theory looked tidy on parchment. And then we get to the ointments, the kind that make modern people stare into the middle distance and ask how civilization survived long enough to invent plumbing. Medieval wound care and folk medicine sometimes used animal excrement in salves and poultices. Cow dung, pigeon droppings, dog feces, even human waste in some traditions. The logic was not always the same everywhere, but the general idea was that these substances could draw out infection, dry a wound, or carry some hidden medicinal power. In a world shaped by humors, sympathetic magic, and inherited folk practice, The line between medicine and superstition was thinner than a monastery candle. To be fair, some of these mixtures were not chosen purely because someone had lost a bet. Certain animal wastes could contain ammonia or other compounds that might have had a drying effect, and some poultices may have provided warmth or helped keep a wound covered. But that tiny sliver of possible usefulness came wrapped in a giant blanket of contamination. Fecal matter is not a healing miracle. It is a microbial crime scene. Medieval people did not know about bacteria, so they could not see the invisible army they were smearing into open wounds. They saw a substance that seemed earthy, potent, and traditional. The wound saw a buffet of infection. The same grim logic applied to all sorts of poultices and ointments. Honey could be genuinely useful because it has antimicrobial properties and can help keep wounds moist in a controlled way. Vinegar, wine, herbs, fats, waxes, and animal products all appeared in recipes. Some mixtures may have soothed pain or protected skin. Others were just medieval guesswork wearing a fancy label. The problem was not that every old remedy was nonsense. The problem was that nobody could reliably tell the difference. So the healer mixed useful ingredients with useless ones, and sometimes with outright dangerous ones, then applied the whole mess with the confidence of a man who believed tradition was basically the same thing as proof. This is where medieval superstition and medicine held hands and walked straight into a ditch. If a wound smelled bad, maybe it was corruption. If a fever lingered, maybe the body was imbalanced. If your body is screaming, do not let some medieval clown with a bowl of leeches and a prayer book gaslight you into thinking that suffering is a personality trait. The old world had a talent for turning panic into procedure and procedure into a mess. Sometimes a remedy helped a little. Sometimes it did nothing. Sometimes it made everything worse, and then everyone acted surprised, which is honestly the most human thing in history. Medieval medicine lived in that ugly space between faith, folklore, and guesswork, where a healer might pray over you, poke you, drain you, smear something foul on the wound, and call the whole circus a success if you were still breathing by sunset. That is the part modern people need to remember. Not every old remedy was pure nonsense, but almost none of it was reliable in the way we expect care to be reliable now. A few ingredients had real effects. Honey could help protect a wound. Clean cloth mattered. Rest mattered. Warmth mattered. But those useful bits were buried inside a system that did not understand germs, infection, dehydration, shock, or internal bleeding. So the patient became the battlefield, and the body had to survive not only the illness, but also the treatment. That is a rough deal. That is the kind of healthcare that makes you look at a bucket of blood and say, wow, maybe the disease was not the only enemy in the room. Warning signs mattered then, and they matter now. If a wound became red, hot, swollen, foul-smelling, or started leaking pus, that was not the body balancing itself. That was trouble. If a fever came with confusion, weakness, trouble breathing, or a rash that spread fast, that was not a cute little humoral mood swing. That was a serious problem. If someone was vomiting repeatedly, could not keep fluids down, had severe diarrhea, fainted, had chest pain, severe belly pain, or became hard to wake, that was not the time to wait around and hope a saint handled the paperwork. That is the time to seek medical help. Seek help quickly if you notice any of these red flags. A wound that keeps bleeding. A cut that is deep, dirty, or caused by a bite. A fever that lasts or gets worse. Signs of dehydration like dizziness, dry mouth, very dark urine, or not peeing much. Sudden weakness on one side of the body. Trouble speaking. Severe headache unlike your usual headaches. Confusion. Seizures. Trouble breathing. Blue lips. These are not medieval mysteries. These are modern emergencies. Health tip. If something looks infected, gets worse instead of better, or starts affecting the whole body, do not play hero. Clean the area gently if you can, avoid putting random substances on it, and get proper care. The body is not a castle wall that can be patched with mud and optimism. It is a living system, and when it starts failing, timing matters. Avoid the old instinct to wait and see when the signs are clearly getting worse. That is how small problems become big ones. A minor infection can turn serious. Dehydration can spiral. A fever can be the first clue to something dangerous. Medieval people often had no better option than prayer and tradition. You do. Use it. And yes, There is a grim lesson buried in all this gore. Human beings have always wanted certainty. We want a clean explanation, a quick fix, a ritual that makes the fear go away. Medieval medicine offered that comfort, even when it was wrong. It gave people the feeling that something was being done. That feeling can be powerful. It can also be deadly. So respect the past, but do not romanticize it. Safer care exists because people learned, painfully and often too late, that bodies do better when treatment is based on evidence instead of vibes and a suspiciously confident barber. So fear the cure, but learn when to seek help. If symptoms are severe, sudden, or getting worse, get medical attention. If a wound looks infected, if a fever will not break, if breathing becomes difficult, if there is chest pain, confusion, fainting, or signs of stroke, do not wait. Call emergency services or go to urgent care right away. And before trying any home remedy or traditional treatment, consult a doctor first. The gallows humor is funny until it is your body on the table.